Okay, welcome everybody to our May Utah Children's Care Coordination Network. We're so glad that you can join us today. Um, we want to go ahead and get started. We have a little bit of a full agenda, so I'll go ahead and jump into our slides. So we'll start with our announcements, and then we're going to have a highlight on a new resource, an early childhood search tool that Jennifer Floyd from the Utah Department of Health is going to highlight for us. And then we'll move into our learning session. Today it's on the Title V needs assessment results. And then we'll have a little bit of time for question and wrap up at the end. So just a reminder, if you have a minute to go ahead and rename your Zoom profile so we know where everybody's at, you should, if you hover over your picture, in the upper right-hand corner, you should see 3 little dots. From there, you can click on the dots, and there's an option at the very bottom to rename yourself. If you can include the agency you're from, and then also if you want to introduce yourself in the chat, that just helps us keep track of people who are attending this meeting, especially if you're joining us for the first time. We'd love to have your email address included in the chat so we can add you to our listserv as well. So just take a moment to do that. This can start coming in as we get going. So for our announcements today, we'll go ahead and turn some time right over to Jennifer Floyd, who's going to talk to us about this new tool that we can all use.
Thank you. I'm glad to be here with you today, and I appreciate you taking time to look at this tool. I see that I know quite a few people here, and one of the things that I'm going to talk about, you probably already know a lot about, because Carrie Martinez, I know, will have told you, and her team is all here, about our 0 to 8 care coordination. But I'm hoping that this tool that I want to tell you about will be useful to you in your work as you're going, as you're working with families. So in 2019, the state got, through the Office of Child Care, a preschool development grant. It's been a desire of the state for a long time to have one central place where people could go to get information about early childhood services. And so in 2019, they did a study about what that could look like, what sort of a website that would look like, and then they didn't get more funding again until 2023, and that's when we started building this website, and we launched it just in March of this year, so it's brand new. And I'm going to show it to you so that hopefully I can share my screen. I'm going to show it to you so that I can walk through the features of this with you. It's something that we're hoping that families will be able to use for themselves, but then that you as providers will be able to use to help find resources for your families. So this is the earlychildhood.utah.gov website that just launched. We've had, I looked this morning and then I forgot again already. I think we've had about 16,000 visitors so far to this site, and lots of requests for help through this site. Now, you might first, I think that your first question will be like my first question was when I heard about this site was, don't we already have 211? Why do we need another website? And I think my colleague has the best description. So 211 is like the yellow pages. It's got everything. And this is like your mother's phone book where she doesn't list all of the plumbers, but she lists the plumbers that will help you. So that's what we've really tried to do with this website, is really curate the list of resources. So we would not call this a comprehensive list of resources in Utah, but it is a curated list of resources in Utah, so that what we're hopeful is that the best things for a family will pop up first, and that will help them to get the help that they need. So let me just show you how it works. Um, on this welcome screen, you can see that there are 3 different ways to find services. You can answer 4 questions to be guided. We are hoping that most people will do this. Second, they can connect directly with a care coordinator. And this is something that I don't need to preach to you about, but we know that if a family in need gets connected to a live person, they are far more likely to get the services that they need. So we really want to encourage families at that first frustration point to reach out for help. Because if they're reaching out for help early, then they're more likely to get the services that they need. And then there will be some people that just are curious about what's on the site so they can browse by topic, or they really don't want us to know anything at all about their family, which we're not asking for any private information, but I understand that there are some people that are a lot more private than I am, and so they don't want to give us even this basic information. So how this works is these 4 questions. What are your primary concerns? How old are your children? What zip code or city are you searching in? And how far do you want to go outside of that? So I'm going to just put in, for example, if you're looking for special needs and early intervention and you've got a child that's 2, well, I live in Payson and I don't like to drive, so I don't want to go anywhere outside of my area. Then what should pop up is the early intervention sites that work here in my area, of course, and then some other places that I might go for help. But hopefully the one that comes up very first is going to be the one that I ought to talk to first. And then Help Me Grow is on almost all of these because, of course, we know Help Me Grow is a great resource, and Utah Care Coordination is going to come up. So I just want to show you that if I change this search and say, oh, wait, my kid's too old for early intervention. Now I'm putting this to the test because this is still, it's still a new website, but early intervention should not come up for my 4-year-old. Instead, I should be getting referred to Head Start and to the school district or whoever is doing the Part B in my area. So hopefully that sort of curated search will help most people find the services that they need. I'm going to go back again to show you, well, actually, I'm going to stay right here because I want to show you how we've written our descriptions too. With the descriptions, we have included a website link everywhere because everybody's got their website. This website link, we've gone to pretty great extremes to make sure that with this one click, you're not just going to the main school district webpage, you're going to right where you can start applying for services or finding out about that service. So we've curated the website links. And then in the description, we've put a lot of effort into making them sound friendly and helping people know what they're going to get when they call in really inviting language. And you can see, this is one I like to show because you can see how it says right here in bold, the easiest way to access services is through a phone call. We've tried to really highlight for people, this is the easy route. Go this route for this service and go this way for this other service. We list contact phone number and address only if these are ways that a person could get services. So you'll only see an office address on services where you could walk in and ask for services. If you couldn't walk in, we don't list an address because we don't want people to drive there and then be frustrated. So we've gone to that kind of care. Hopefully that's helpful to you as it is to our families. This has all been translated by native Spanish speakers, and so all of this, it's not Google Translate, it's all been manually translated into Spanish. And then we do have the translate button for people who speak other languages. The other thing that I just want to show you and highlight is that we do have this request support button that will help people get in contact with Carrie's team quickly. So when they request support right here, they can put in their name, email address, or phone number. They can put in both, but we only require the one that they want us to use to contact them. We ask for a comment if they want to tell us something. I don't know, I'm thinking about 80% of people don't tell us anything on those contact me requests, and Carrie's team just gets back to them and starts the intake. So when they submit that, they're going to get a response within 1 business day. I'm pretty sure that right now they're getting a response a lot faster because we're all super excited about this website. But as it gets going and we get more requests, it might take us a little longer. But this is a really easy way for people to get in touch with that 0 to 8 care coordination. And then of course they can call or email if they don't want to put information in. So that's the tool that I wanted to show you, and I'm hopeful that it will be helpful to you. And I have only just one request, which is because it is a new tool and we are launching it, it's been launched for about 2 months so far. We're still accepting any feedback that you want to give us about, this doesn't work the way that I think it ought to work. This doesn't say what I think it ought to say, or this is a really wonderful resource that you're missing on your site and that really ought to be there. So please feel free to reach out to me, and I will be glad to take your input, and we're just continually reviewing the site and working on upgrading it. And then the last thing is I am going to send out some printable flyers to Athena so that she can distribute them with the meeting notes, and you're welcome to hang them anywhere you would like. We want to get the word out to Utah families to be able to use this.
Thank you, Jennifer.
Does anybody have questions or anything they'd like to comment about on this?
Jennifer, do you want people contacting you by email if they have feedback about the site, or what's the best way to get that feedback to you?
Email is the best.
Okay.
If I get a phone call, I get shocked. So yeah, send me an email. That'd be great.
A question came in the chat and says, do you know if there are programs similar to this in other states around us?
I don't know in any of our neighboring states. A lot of our ideas came from a website in South Carolina. And just so you're aware, that website is able to collect a lot more personal information. And there are websites around the United States that are similar. They collect a lot more personal information and then are actually able to do eligibility and intake for many programs. We have not got to that iteration of this website yet, partly because our state is working on a My Utah portal, which will handle that for us. And so we will be linking to that when it comes online.
Maybe a follow-up question to that is, do you list services that maybe are available for people on the borders of the states, or people that are maybe just across state lines but could access services in Utah?
Good question. They would have to search for a Utah zip code or a Utah town to be able to find those services. So
like somebody who lived in Wendover, Nevada, maybe would have to use the Wendover, Utah zip code as an example.
Correct. Yes, and because we do isolate out of Utah zip codes that they're not mapped to services.
Okay. Carrie, did you have a comment or question?
Yeah, I was going to share that Colorado has invested a lot of money into the early childhood system, and they do have a website that isn't a resource like this, but does have some places that will help families get connected to early childhood. And then New Mexico, I mean, these are back to that original question, like not quite neighboring, but if a family is on the border or maybe in between could visit. New Mexico also has a really great early childhood system. I don't have the website for New Mexico in front of me, but I do for the one for Colorado. So I'll put that in the chat. But as Jennifer said, if they like St. George has a lot of families that are, border just outside of Utah that access a lot of Utah services and get exceptions to that. So they could just Google St. George zip code and then get services or reach out to us via that QR or the care coordination email.
Right, and they
Thank
don't
you.
even have to know the zip code, which to me that would be kind of like a hindrance. They just need to know the name of the city. They type it in and then they can look for it. So, and for those people who are living on the border, I bet they do that all the time.
Perfect. Thank you so much. Anybody else have any questions on this new tool? All right. Thank you for joining us, Jennifer.
Thank you. Have a wonderful day.
Thanks. All right. We have just a couple minutes for our brainstorming. If anybody has a case they want to bring up or a new resource to share, other announcements you want to let us know about. Yes, Eric.
This isn't so much a resource or a case per se, but I'm always kind of curious to get the pulse from our members across the state as far as what's happening with our kids receiving Medicaid or receiving services that they've been receiving previously, anything like that. Just given our kind of interesting climate politically across the state. I'm just wondering if anyone's noticing, any sort of lapse in service or folks that had been coming into clinics or local health departments or anything like that who aren't seeking those services any longer, or if it seems to be business as usual.
Hi, Eric. It's Kaylee in Tri-County, but I actually had one family that I feel that this applies to is we had one family that I was working with CSHCN and also for WIC, and they completely I don't know, they kind of fell off the radar. I don't really know what has happened, but yeah, they quit coming to their WIC appointments. They quit returning my phone calls. Everything. Like they just quit everything that they were participating in.
Yeah, I appreciate that. I see Abigail put in. I've noticed that when talking with families who are uninsured, they are very afraid to apply for Medicaid due to immigration status. Okay. Anybody else having similar issues?
This is Gwen. I didn't see where I could raise my hand because I'm not tricky, but I'm seeing the same thing that people do not want to apply even for like WIC, which is supposed to not have a public charge, and that they're really careful to ask before. I've never had anybody ask me how I keep track of like referrals, and I've had a couple ask me, now, do you put me in a system? How do you, that kind of stuff. I had an interesting conversation, I think Monday, with housing. I had faxed over a housing application for a family and uploaded their IDs. And the housing person here in Carbon County, but I understood it. I may have misunderstood it. So if anybody knows, I'd like some clarification. They said, thank you, we've got it. They're on the wait list, which is, the 6 to 12 months. But currently, right now, we have a freeze and we are not allotting any money for housing or Section 8. And I don't know if that anybody else has heard that. So it kind of the way I interpreted that is that even if there was like an open apartment or a place available for whoever was next on the list, that they wouldn't be issuing that. But I'm not sure if I misunderstood that or not. So that's kind of a squirrel.
Hey, thank you, Gwen. I appreciate that.
So, Eric, this is Walt, and I've had a handful of families also that have been very hesitant to go, Hispanic families, and some of them actually were legal completely and no problems whatsoever on being here illegal, and they were very hesitant. I guess it came down to the point that we talked it out that what were the benefits and the risks. And so with some, I'm not quite sure if they did or not, and others, I think, finally did go into that. But I've have a lot of families that are kind of scared and worried, just the unknown, pretty much.
Okay. Thank you.
And I mean, this is Amy. I would just add that as things are changing federally with Medicaid and the possibility of a lot of changes happening, I think if you all are aware or hearing these types of things, sending it into the chat, because we do have communications with Medicaid, and perhaps we can share that up just from the community in a different mechanism as changes start to be implemented for your families. So.
Yeah, that's a great reminder. Thank you, everyone, for sharing kind of what you're hearing is happening in the community. I think it helps us all keep tabs on the constantly moving targets that are currently out there. Does anybody else have anything you wanted to add to that question from Eric or Gwen's question about housing services?
I guess I would just say generally to this group, please feel like you can use the listserv feature here to, if something's happening in your area, or if you receive notice of any policy or information that directly affects your ability to serve families or families' ability to obtain services, please shoot that out to the listserv so we have, that type of information that we can investigate on our end and, see if we can look a little bit deeper into what those ramifications are and share that back out.
Hey, Eric, I was just going to mention that DSPD, the wait list, if you would have, like a year ago, there were about 4,000 Utahns on the wait list. Now there's over 6,000 on the wait list. We heard last week about that. So that's another, we're having, the wait list is just getting longer and longer.
Yeah, we were at an event in Price the other day and sat right next to the DSPD folks. And God bless them, because I think that'd be a really tough job to have to, tell people that they're on a wait list. But they did indicate that 6,000 person wait list. But as I've always told families for years, you never are going to get to the services from a wait list if you're not on that wait list. Yeah. So, always good to get folks that may qualify for DSPD services on to the wait list. Even if you're number 6,000, better to be on that wait list than not.
Absolutely. And I haven't had families decline to want to sign up for that. They're still signing up all the time.
Okay. And thank you for that info.
Yeah, Liz.
So this is just something I just wanted to throw out there. This is from Phoenix Osterman from Know Your Neighbor. And she mentioned that, and especially now as resources are getting scarcer and families are really struggling, they have a lot of people volunteering. And the program is you can sign up a family or they can sign up, and just someone in the neighborhood or in Salt Lake County will visit their house every week, and they can help them, access resources, learn English, basically just check in with families. And I just thought it was such a great program because I've signed up some of my families for this program, and they've just made amazing friends, and these people can advocate for the families. So again, it's Know Your Neighbor, and it's Salt Lake County. And I just think it's a great resource for these families beyond what we can do, just to have someone checking in with them every week. So just wanted to put that out there. Oh, and one other thing I should mention, I think it's mainly for refugee families. So yeah, I'm not sure exactly though, but it says, let's see on here. Yeah, I think it's mostly for refugee families, but any refugee families could qualify for this program.
Great, thank you for sharing that. I'll get it, I'll send it out with the meeting notes as well, a link to it. And our meeting next month is actually all about immigrant and refugee services. So just a little plug for that as we as a topic for next month too. I'm sure it'll come up again. So we're excited to hear about any resources out there as other programs maybe start to shrink. So all right. Let's see. We'll go ahead and move into our learning session for today, which is about the Title V needs assessment results. And Amy, Nance, and Stephanie Pocius are going to talk to us about that today. And I wanted to just I think we all know Amy well. She attends these meetings regularly, but we may be less familiar with Stephanie. So I just wanted to give you a little introduction about her. She's the program manager for the Utah Birth Defects Network, and which is a statewide surveillance system for birth defects and critical congenital heart disease. And so she's been with the Department of Health and Human Services for about 3 years after finishing her master's in infectious disease epidemiology with a concentration in maternal and child health. So we're glad to have both of them here with us today, and excited to learn from them about the results of this important statewide survey.
Try to. Okay, can you see my screen? Hopefully.
Yes.
Okay, awesome. All right, I'm going to quickly just give you a quick overview of what Title V is, and then Stephanie will share more about the needs assessment directly related to children with special health care needs. So the Title V grant operates within the public health framework. It's guided by 10 essential public health services. Sorry, I'm losing track right now. What is the grant? So the Title V block grant is from the Social Security Act. It's a critical source of federal funding dedicated to improving the health of mothers, infants, children, including those with special health care needs and their families. It was established in 1935, and it is one of the longest standing public health programs in the United States. The Title V block grant for maternal and child health supports a comprehensive public health approach focusing on prevention, population health, and ensuring access to critical and essential services. A key component of the Title V is that it is data-driven, and through ongoing assessments and performance measurements, we identify needs, guide programming, and continuously improve outcomes. Partnerships are essential to our success, and engaging families and community organizations and healthcare providers to ensure our services are responsive and effective. The Title V has a strong emphasis on health equity and assurance, and our goal is to ensure that all mothers, children, including children with special health care needs and their families, can access services and achieve their full health potential. So again, our Title V, it's our framework uses the Title V or the Essential Public Health Framework, and I'm not going to spend time on this, so Steph has time. Our 5 population domains that the block grant covers or works to work with families are women, pregnant women, and postpartum women, infants, children, adolescents, and again, children with special health care needs. And this is our mandate federally to work within these 5 population domains. Again, I'm not going to spend a lot of time on the framework, but through the Title V block grant, we have national outcome measures, national performance measures, and then we use evidence-based strategy measures. So this is what we're doing at the state to help get funds out into the community and through our programs. So the needs assessment has to be done every 5 years. We're required within that federal guidance to do that. We use those findings to really determine how we move forward over the next 5 years. So we just are completing our 5-year needs assessment for our next grant period. So because this is federal funding, it works on a federal fiscal year. So that's from October to September. So we're looking at the next 5 years starting in October until September of 2030. So these are the measures that we're creating. The primary goal of the Title V needs assessment is to improve maternal and child health outcomes and to strengthen partnerships to ensure the effective implementation of strategies that address the needs of Utah's women, children, and families. This is just to quickly show you where our priorities have been over the last 5 years within each of the areas. These are the areas that we are tasked with overseeing and picking measures over these next 5 years. Medical home is a universal measure, and so that is a requirement of all states in the United States, as well as postpartum visits. So just a caveat there. So again, today's purpose is just to share the needs assessment findings. After, if there's time, I can tell you what our priority measures are moving through 26 or through our next 5-year grant cycle, and then just identify any collaboration or opportunities to improve the health and well-being of Utah's women and children. So that was really quick so that Stephanie can really share the actual results of our needs assessment.
Awesome. Thank you, Amy. Can everyone see my slides okay?
Yep.
Perfect. Cool. Thank you. Okay. Hi, everyone. I'm Steph Pocius, and I'm the program manager with the Utah Birth Defect Network. And I helped with analyzing and putting together the needs assessment, children and youth with special health care needs section of the surveys. I will be going a little fast through some slides. I want to make sure we have some time at the end just to talk about the DHHS recommendations and any other ideas you might have. So our objectives today will be overviewing the needs assessment and the 3 different surveys we conducted, reviewing the prioritization and needs identified from the community and provider surveys for children and youth with special health care needs, who I'll be referring to as SHIN going forward. We'll also review needs identified, again, from the community provider caregiver survey, discussing DHHS recommendations, and then hopefully some extra time for group discussion. So as Amy just talked about, every 5 years we conduct a needs assessment for the block grant to capture the experiences and needs of Utah and SHIN. And we did, again, 3 surveys. So we had a community and provider survey that had a response of 1,011 respondents. We created a caregiver for SHIN survey. And then we also conducted focus groups through the Utah Parent Center. The community and provider survey asked participants to rank the SHIN domain national performance measures, which were medical home, transition to adult healthcare, and bullying. Medical home was ranked the highest national performance measure among the 1,000 community and provider respondents in the SHIN domain. And this was seen across all different subgroups within the respondents. So we also looked at the ranking of the national performance measures by the community or provider. And again, both said that medical home was the biggest priority in their eyes. And the same was also found for those in rural and urban communities. And it was also similar between racial and ethnic communities. So again, a very big need for medical home resource or for a medical home and focusing efforts on that. The community and provider survey also asked respondents to rank other issues of concern. Finding SHIN resources and services was the top concern overall, followed by increasing the number of qualified SHIN providers and supportive school accommodations. Finding SHIN resources and services was the top concern for both urban and rural respondents. Rural community members prioritized access to SHIN services in all regions and more community-based services as compared to urban respondents, which prioritize school support and having safe, affordable housing. We'll go in a little bit more depth later, but we did find similar findings in the caregiver and focus groups. Rankings differed slightly between racial and ethnic groups. Non-Hispanic, non-white community members prioritized healthy food, safe and affordable housing, and quality affordable medical care. Hispanic community members prioritized mental health care, and non-Hispanic white community members prioritized SHIN services in all regions in Utah. So given the community and provider results, there's a need to continue focusing on medical home and using medical home as one of the main national performance measures for SHIN in Utah. The second part of our needs assessment was the caregiver survey, and we created it to dive a little deeper into the needs of Utah's SHIN community. We used multiple resources, such as those from AmChip and HRSA, and community and professional input to develop the survey. The final caregiver survey was split into 2 sections. Section 1 contained 36 questions across 6 subsections outlined on the right that surveyed experiences with healthcare services and resources. And then Section 2 just had 8 questions on demographic information such as age, residence, and employment. We had a total of 731 respondents to the caregiver survey, capturing responses from caregivers with 1 or more children or youth with special healthcare needs, and we also received 20 responses from adults with a special healthcare need. Anxiety, autism spectrum disorder, and sensory processing disorder were the most common diagnoses. We found that children under the age of 5 reported developmental delays more frequently, and behavioral and emotional diagnoses were more common among children above the age of 6. While 12 out of the 13 local health districts were represented in the caregiver survey, roughly 81% of responses came from caregivers residing in urban areas. So a little bit more urban responses and urban experiences were captured in the caregiver survey. So the caregiver survey also incorporated questions related to the Blueprint for Change. I won't go too much into depth for it, but it's just a framework of health equity, quality of life, access to services, and financing of services. And through the Blueprint for Change, they have areas of concern that relate to SHIN. And when we asked caregivers their top concerns using this framework, the top concerns were financial burden, long wait times, adequate insurance coverage, availability of services and resources, and availability of quality mental health care. I won't go into this one too much, but it just further shows the questions related to the Blueprint for Change and how caregivers responded with their level of concern. We also looked at top levels of concern by residents. So urban caregivers tended to be more concerned about financial burden and insurance coverage, while rural and frontier caregivers were more concerned about availability of resources and services and long wait times to access care. We also asked caregivers about their child's insurance coverage. A very high percentage, 98.4% of caregivers indicated their child is currently enrolled in a health insurance plan, and over half of respondents said that their child's health insurance plan always or usually offered necessary benefits and covered healthcare services. Though this was also lower, though, when examining coverage for mental or behavioral health services, which shows, again, a need for more mental health services and coverage. And we also did not see any major differences in those in responses between those on public or private health insurance plans. So one of the national performance measures, again, was medical home. And this is an approach to providing comprehensive and high quality primary care. There's five aspects of a medical home, which is having a personal doctor, a usual source of sick care, family-centered care, receiving referrals for services, and receiving care coordination services. So when looking at the subsets of what a medical home is for SHIN, we found a pretty high indication, or a high indication of SHIN having at least one personal doctor and a usual source of sick care, and roughly 3/4 of caregivers indicated they felt they were receiving family-centered care. However, we did note an absence of care coordination among respondents. So I don't need to go into the details, you all know the definition, but care coordination under the block grant is a patient and family-centered, assessment-driven, team-based approach to meeting the needs of SHIN while enhancing the caregiving capacity of families. Among the 61% of caregivers that felt they could have used extra help arranging or coordinating their child's care, only 24% felt that they always or usually received the help they needed, and roughly a quarter of respondents were aware of their child's healthcare team's communication with other providers. And there was only 27% of respondents saying that they received care coordination from someone other than themselves, and the most common sources of coordination were their child's primary care provider, DSPD, and their child's school or school district. The second NPM that the caregiver survey covered was transition to adult healthcare, which is the process of moving a child to an adult patient-centered model of healthcare. And in the block grant, this is measured as the percentage of youth aged 12 to 17 that received services to prepare for the transition to adult healthcare. In the caregiver survey, we found that 63% of respondents indicated that they or their child have special healthcare needs and are above the age of 12. Only 31% of caregivers have discussed transition to adult healthcare plans with their child's provider, and only 17% indicated that their child's healthcare providers have discussed an adult healthcare plan. And what we found was very interesting was among the 31% that did indicate they've discussed a transition healthcare plan with their child's provider, the topics discussed were actually geared more towards educational, employment, and financial plans, and not necessarily medical care plans. Similarly, less than 40% of caregivers were aware that their child's healthcare provider discussed changes in healthcare plans or discussed gaining skills to manage their health and healthcare independently. And then now I'm going to go a little bit more into the specific barriers and needs that we found through the survey. And in order to meet needs within the SHIN community, we just need, of course, like a better understanding of the actual barriers being experienced in Utah. And I threw in some quotes that we had from the focus groups. I won't read all of them, but for example, one parent said we have to wait months for an appointment because there's so many people here competing for the same services. I feel like we're at the mercy of whoever's available. Sometimes we drive hours on end just to find out that the specialist canceled. And nearly half of the respondents in the caregiver survey said that their child had a hard time getting equipment or an appointment with any healthcare provider in the last 12 months. Oh, not too fast. So we also asked for specific difficulties with accessing services and resources. Caregivers indicated that in the last 12 months, they had the most difficulty accessing mental, behavioral, and developmental health providers, prescription medications, and recreational and social opportunities. And caregivers indicated that waiting lists, financial costs, and unavailability of providers were the largest barriers to accessing services and resources for their child. Similar to the other survey results, we also found that difficulties and barriers accessing services and resources differed between groups. Rural and frontier caregivers reported more difficulty accessing certain medical services, such as dental care, genetic counseling, finding community groups, and receiving transition to adult healthcare services. Barriers due to a lack of experienced providers and services in their area, far travel times, and unavailability of telehealth were reported significantly higher among caregivers living in frontier and rural areas. We also looked at differences in barriers and difficulties accessing services between public and private health insurance plans among the caregivers who responded. And we found that the caregivers whose child had public health insurance more frequently reported difficulties accessing social support opportunities and clinical services such as care coordination and dental care. A lack of guidance and coordination to find services, as well as transportation barriers, were more common among those on public health insurance as well. The last section of the needs assessment for SHIN included the focus groups conducted through the Utah Parent Center. We had 10 focus groups with a total of 56 parents and caregivers of SHIN. The dominant themes from the focus groups echoes what was found in the community and provider and caregiver surveys. There's just general frustrations navigating complex health systems, stress related to financial burdens, and barriers to equitable care. I won't spend too much on this one, but again, the focus groups just highlighted general frustration with all these complex systems. There's geographic isolation in rural settings, but then system overload in urban communities. Stigmatization was frequently discussed in the focus groups, in addition to difficulties finding social opportunities and support groups for families. Both challenges and strengths of transition services were also discussed. Challenges included a lack of planning and support with limited adult services, while strong school support and vocational training programs were highlighted as strengths. The focus groups also highlighted the experiences of Spanish-speaking families, of whom indicated similar difficulties, though challenges were worsened by language barriers and lack of cultural humility. So in summation, the community and provider survey, caregiver survey, and focus group discussions all highlighted similar needs within the SHIN community in Utah. Medical home is the highest ranked national performance measure between community members and providers, and results from the caregiver survey and focus groups indicated frustration with the lack of coordination and difficulty navigating complex systems. Resources and services that serve SHIN are difficult to find and not centralized. Financial strains are a major challenge for families who have a child or youth with special healthcare needs, regardless of their insurance coverage. Transition to adult healthcare services and resources, as well as having access to knowledgeable providers are lacking. Both caregivers and SHIN frequently experience feelings of social isolation, stigmatization, and a lack of community support and social opportunities. And while needs are similar across Utah, certain communities experience different challenges that require solutions that fit their needs specifically. So given these results, DHHS recommends that medical home and transition to adult health care are the SHIN national performance measures to be focused on for the next 5 years. With a comprehensive and health equity lens, we can also address other top concerns raised by SHIN community members. Again, medical home was the highest ranked national performance measure, and care coordination is the specific piece in there that we would like to try to focus on also going forward. It also demonstrated a lack of providers that are educated and equipped to deliver transition to adult healthcare services and resources, which is also compounded by inadequate care coordination for SHIN, as we found in our survey. Sorry, that was really quick. I know we have 10 minutes, but that was a little quick. I know we'll send out the slides as well, but are there any initial thoughts? Or Amy,
Hey, Steph, I'm gonna take the screen.
Yeah, perfect.
I'm just going to, Carrie has a question, so go ahead, Carrie.
Stephanie, thank you so much. This is great. I appreciate you putting it in slideshow form, letting us look at it and sharing this information. Thank you. Quick question about parents reporting that sometimes they had these long drive times, long wait times for appointments, show up and don't have a doctor or find out the appointment's canceled. What specific reasons was that? Were you given for that? Is it because we're losing doctors? Um, are we becoming like a health island? I'm just curious what some of those specific reasons were for that.
Yeah, that was a common concern among the frontier and rural respondents especially. So I know that was one of the biggest issues, just being down south and away from, the Wasatch Front. It was proving to be one of the biggest barriers itself. We didn't ask too much in depth about other reasons, unfortunately, but
And I would say that also came from the focus groups. So we contracted with the Utah Parents Center um, to facilitate those focus groups. So we could speak to Esperanza and team who really did that and see if they have a little more insight into that, Carrie. It wasn't it was a comment that was shared, but I don't know that we were there. Like I attended several, but I wasn't there when that comment was shared. So I don't know the context or if there was other, information shared there. Go ahead, Natalie.
I have a family that this happened to, and what happens, Carrie, is sometimes, let's say you have a appointment with a neurologist. If there is an emergency and they get called into surgery, there's nothing they can do. Like it's the inherent business of medicine. It's very unfortunate, but it does and can happen for very legitimate reasons. Now, I don't know. I can't speak to this particular situation, but it can happen for a legitimate reason on occasion.
Oh, for sure. I was just curious if maybe there was some highlighted top reason that maybe we could approach or problem solve in our going forward goals and objectives. Like if it was that we only have two doctors that are traveling to this location, maybe we could have three. And then if there's a problem or something, then there's a backup plan or something. That's all I was curious if there was specific reasons.
Harry, I've run into this as well, like what Natalie was just saying. I had a family from Blanding come up for neurology. No neurology that day. I've had a local health or a family go in for a mental health appointment. Provider didn't show up that day. So I've gotten to the point where I'm telling families when, especially for these bigger appointments that they've been waiting for, call the morning of if you can, or even the night before, if you're leaving, just call and like triple confirm the appointment. So I'm just trying to have families do that now.
Yeah. I did just want to share, these are the national priority measures that we will be working on in all of the domains. And as Stephanie mentioned, transition and medical home are what we're working on. Through the block grant, we're able to provide UCCN. We contract with the University of Utah in this collaborative relationship. And so
Amy, are you showing slides right now?
Oh, is it
Because
not
I can see your
showing?
calendar and
Oh,
you're very
well, like
busy.
we want to see my calendar. Hold, please. Sorry. Um, dang. There, how about this? Can you now see the slide?
Yes.
Okay, thanks, Eric. Sorry about my calendar. So again, these are the national performance measures that we will be moving forward with in all of the domains, just to give you an idea. But actively within the CSHCN realm, again, we'll be working on medical home and transition. Obviously, the work that you all are doing out in your clinics directly affect developmental screenings. I mean, you're affecting all of these areas. But we just wanted to share about, how this group is facilitated, the efforts that we're doing here at the state, what the block grant is, and just to share about our work and the needs assessment and share back what our findings were. Are there any other comments in regards to the block grant?
I just wanted to comment on just one important thing from the block grant, though. It supports our Utah Children's Care Coordination Network. So that is one of the, I just think, valuable services that comes from our maternal child health block grant funding is our ability to convene these meetings every month, to have our listserv, to have this powerful peer network where we can share this type of information, these learning sessions, and really rally the combined knowledge of so many care coordinators and practice managers, other folks who have a lot of experience and know a lot of resources out there. It really comes to me, it really just demonstrates how powerful it is when we get one of those cases where we don't know about a resource or we're really struggling with something, and all of a sudden my email lights up like a slot machine with everybody across the state popping in all sorts of ideas, resources, and ways to share information. So this is just one of those really terrific things that we're super proud of. When we go to block grant review every year with our reviewers, they're always very impressed that we have a care coordination network. And a lot of states ask us, how do we do it? How are we able to get so many people together for something like this, and want to know how to replicate it? So you're all part of something that I think is really, really special and powerful, especially in a state with a lot of rural and frontier areas with kids living in those areas who need the services and the care coordination that is provided. So just a big thank you to all of you.
Thanks. Does anybody else have any final questions for Amy or Steph?
No, I'm sorry. I have to jump off. I have to be on
Yes,
another
that's
meeting in 1
fine.
minute, but Eric and Steph can answer any questions. But it was very nice to share about the block grant and our efforts. And again, if there's anything that we can do to help, we're here. So thanks, everybody.
Thank you. I'm gonna put up one final slide as if anybody has any other thoughts, though, while we are just wrapping up. Our next meeting is going to be on June 18th. The topic for that day will be about immigrant and refugee services. And of course, always you can stay connected on the listserv in between or the Facebook group. Which I will fully admit that I have recently ignored, but I have it on my list to put some stuff on there again lately. So you can look for stuff there too. Thanks everyone for joining us today.